mental health is something that no one wants to be associated with, particularly because of the cultural issues and stuff. My name is Darko Kotevski. I arrived to Australia in 1988. Well, I was diagnosed with clinical depression in 2004. My serotonin was actually extremely low, critically low. Fortunately, my doctor actually recognized it. And I'm having anxiety attacks in the middle of the shopping center when I couldn't breathe, and I would walk out, storm out. The shame was there. I was aware of help. I had an amazing network of support at that time. I was a lucky one. I know a particular case of a man who actually committed suicide because he wasn't actually, his problem wasn't recognized by GP. These things are happening in the community, particularly because of the cultural issues and stuff that are, stigma in the community, in the Croatian community, back in Croatia. Those people who migrated to Australia carrying those conceptions, misconceptions, and this is a bad thing. They're carrying it still with them. Like whoever has a disability must have done something wrong and probably was punished by God. This shame or being afraid of admitting and saying, I have a problem, need help, and could I approach someone? Who, where do I go? I could actually use a sample of a friend of mine who has a son, a disabled son, adult. They're both of Croatian background, of course. On various occasions, he would not go out with his son. He said to me, how many times I've heard the words, oh, this is the man who has an invalid or spastic son. So whenever he would go into community, Croatian community particularly, because of those old-fashioned issues and philosophies, they don't understand. The stigma could be a killing issue. There was a specific situation which I would like to highlight. There was a group of men. I was talking about myself and my problem and my disability that I successfully overcame. When we stopped, got out, one of the gentlemen approached me and said, oh my God, thank you for sharing and opening your heart, for sharing this information, because look, I've been hiding it, and well, up to now, I've never actually approached anyone like this. I'm suffering from the same problem like you. And he found an amazing psychologist who speaks his language. He's been coming to the group for 6.5 years. Opened up, his therapy medication has dropped a little bit, so he's blossomed. This is why the social support groups exist, to support each other, to empower each other, to open up and share experiences. My advice to other people who live with certain level of problems or disabilities in the community, within the community, Croatian community, would be go and ask for help. There are various places and organizations who could provide help. So whether they know about you or not depends on you. You need to approach them, you need to pick up the phone, you need to call, talk to someone who is close to you, who maybe has some information about it, and who would actually support you, because the main thing to get over these problems is to get support. A network of professionals who could support. And there are fundings that are provided for help that people should actually access.